maximize every opportunity so that you can become legendary.
What adjustments can you make right now to make yourself 1%
Your
better?
only goal is to be the best version of you.
Sara, welcome to Becoming Legendary.
Thanks for having me.
Thanks for being on. So it is my understanding that you are both an acupuncturist and a movement specialist. Is that an appropriate summarization?
Sure. Yeah, that's pretty accurate. Acupuncture is kind of my main focus, but I do have a background in sports medicine and strength and conditioning and physical therapy. So all things movement, all things rehab and self-care related.
Cool.
Yeah.
How did you find your way into this particular world?
Into the world of sports medicine?
Into the world in which you exist right now, whatever that entails.
Wow. That's, where should I begin? I grew up, I've always been an athlete. I grew up in a small town in Massachusetts. I have 3 older brothers. They're all athletes. And so, I kind of had that natural tendency to follow in their footsteps. So grew up in a house full of athletes. And the first time I sprained my ankle bad enough to land me in physical therapy, I was about 12 years old. And the moment I stepped foot into that PT room is the moment I realized that sports medicine was my calling. I thought it was just super cool that there was a job that existed that, you could go and help athletes get back into playing their sport. And I had no idea, no idea that was something that existed. And so, from 12 years old on, I had my eye set on that prize of studying sports medicine and, being that, even at that young age, I kind of had an inkling that being a professional athlete and making a career out of being an athlete wasn't, the odds weren't really in my favor. And so, using physical therapy, athletic training, sports medicine, that was kind of my way to let my inner athlete just kind of continue long after, I retired from actually competing. So I was all in. I went all in. I knew from a very young age that some realm of sports medicine was going to be my thing. And, throughout my education, I was exposed to a lot of different types of, different disciplines within the realm of sports medicine and even performance training. And eventually I ended up in acupuncture. It was something that just kind of fell into my lap, and it just felt natural. And it felt like, it was something at the time that no one else was doing. Nobody else, back when I was just getting out of college, nobody else was really integrating this ancient medicine of acupuncture with modern sports medicine. It was still kind of an unknown, very, very, very small niche. And it still is to this day. And I kind of have a natural affinity of taking the path less traveled. And so when I discovered acupuncture, I was like, that's it. That's my niche. And I'm going to be that sports medicine acupuncturist that helps everybody, elevate their performance in life and in the gym. So here I am.
Rad. I like that.
Yeah. That's kind of the short version of how I got here.
That's perfect. Yeah, that is perfect. Okay. So I just realized something as you said it, and everybody has heard the idiom, right? Of like, only 1 in 10 million people become a professional athlete, right? Mm-hmm. But that's true about farmers, and that's true about miners, and that's true about like technical consultants. Like the reality is it's very unlikely we become anything. And I've never realized that before, but it's very true.
Yeah.
It's actually really unlikely that any of us are born.
For sure. Right?
That's true.
Yeah.
Let's start from that. Yeah, exactly.
Let's
right.
start from conception, right?
Yeah.
So yeah, you're right.
Okay. So go ahead, Brian.
No, you go ahead.
Okay. So I want to touch really quick on, the primary points of dysfunction, and I have a guess, and I just want to see if you had to pick the top 2 primary points of dysfunction within the human body, maybe the joints, the two sets of joints, the two joints that have the most dysfunction in the human body. What would you say those are?
Gosh, I mean, that's a really hard question to answer because it's so different from person to person, but like very general, very basic, kind of a blanket answer. I would say hips and ankles. I think a lot of issues stem from hips and ankles. One, because we wear shoes, right?
Sure.
Some of you do.
I know, right? I want my feet to get as much exposure to the elements as my hands do, so I'm barefoot as much and as often as possible. But, we wear shoes that are really restrictive, and it affects our foot and ankle mobility for sure. And when that happens, everything from the ground up is affected. So that's number one. The other thing, I mentioned hips, and other than wearing shoes all day, a lot of us tend to sit down at a desk or, driving a car or whatever. We sit down a lot. So we kind of get stuck into this hip flexed position, and hip mobility, ankle mobility, I think are very common, probably the most common joint restrictions that I deal with in my clinic.
Patrick and I have gone back and forth several times about the restriction that we feel in our hips. So we just turned, I'm 42 right now. I think Patrick is the same age. And we spend a lot of time together on his farm working. We work together as well. So he has this gait that's like about, how tall is that gate, Patrick? Like 3 or 4 feet tall?
It's right 3.5 feet tall.
Yeah, it's right to your left. Exactly right. So it blocks off sort of from his animals, where his animals are permitted and where they're not. And so every time we go in between that space, we're constantly doing like a mini hurdle, with either the right leg. I try to rotate the right leg and then rotate the left leg. And my goodness, I can tell the restrictions that are there that I didn't even know I had by a simple exercise of just trying to hurdle a 3.5 foot gate. So, and not many people are even exploring that on a day-to-day basis, right? So this kind of leads me into my next question, Sara. So because every like physical body that you see and you evaluate is so different, right? So are there specific like tools and techniques you use in your practice to help determine the correct treatment plan? Or is it, I'll leave it at that.
Yeah, no, that's a great question. It's a great question. The modalities, the tools that I use to treat a patient are kind of irrelevant, to be honest. I mean, we can, anything, whether I do apply needles, whether I do body work or movement or breath work, whatever it is, it's all gonna work. But the thing that makes it different or accurate is the assessment. And there's a few strategies that I use. One is neurokinetic therapy, if you're familiar with that, NKT for short. And basically what that is, it's a series of really basic muscle tests that help identify dysfunctional relationships between the soft tissues in the body. So we're testing things like muscles, we're testing things like ligaments, anything with proprioceptive receptors, right? Sure. Scar tissue is huge too. So we're basically running these muscle tests to understand how your brain is communicating with the rest of your body, and if there are any miscommunications or compensation patterns that have developed over time for whatever reason, injury, repetitive movement, repetitive lack of movement, whatever it is, we're able to identify what those patterns exactly are. That way, I know exactly what we're working with, what structures need to be released, which structures need to be activated or strengthened, and how it all might be playing into whatever condition, pain or some kind of dysfunctional pattern. So once we know that information, then I'll know exactly what to do and how to treat it. And based on a number of factors with the patient, sometimes people don't like needles and they don't want to be stuck with a bunch of acupuncture needles, and that's okay. I reach into my toolbox of modalities, and we go from there.
That's a good answer. You mentioned the physical body and the mental body, right? So this is having those two in line is kind of a newer sort of theory or application to the being of a human being. And so I wanted to ask you personally, like, how do you align your physical body and your mental body?
That's such a good question. I'm getting chills as you're saying that. And Here goes another one. I just got another one. That typically happens when whatever I'm talking about, whenever I'm interacting with someone, if it's resonating or if it's a really important conversation, a really important topic, I get this like visceral like reaction.
Heck yes.
So we're going down a good path here. I'm glad you asked the question.
I like it.
Before I answer it, I want to throw in a third part of the body. And I know you know where I'm going with this, and that's the spiritual aspect too.
Of course.
Right? So the mind, the body, the physical body, the emotional body, and the spiritual body, they all matter. They all matter. And for, mainstream sports medicine and mainstream medicine in general, a lot of times we just focus on the physical body. And as you mentioned, this whole idea, this like kind of revolution of opening ourselves up to exploring the emotional body and the spiritual body too, it's such an important thing that's happening. And I'm so glad you brought it up. So to answer your question, what do I do personally? I meditate a lot. I do a lot of restorative type of movement and movements that make my mind connect to my body. And what I mean by that is challenging my balance. So maybe standing on one foot, right? Standing on some, unstable surfaces like like an Eric's pad or maybe a little Dyna disc, or even like a yoga mat can provide some instability, right? When my balance is challenged, it forces my mind to focus on being present in my body, right? Light impact, restorative type of mindful movement is a big practice of mine, aside from meditation that I do all day, every day. I never miss. So meditation's a really big component for me.
Patrick, do you want to ask the meditation question? You want me to ask it?
You ask it.
Somebody ask it.
Okay.
No.
Okay. So we ask all of our guests this. This is I'm going to see if I can get this right. So when you sit and meditate, right? We can, if I was in the room with you, I could see your physical body. I could see the shape you're creating, whether it's, cross-legged or sukhasana, if you want to call it, a comfy seat, a yoga shape, or maybe it's sitting in a chair. So I'm not really interested in how that looks aesthetically, but what we're really interested in is what's the experience like when you drop into a meditation internally? Like, can you explain that to some of our listeners? I think it's meditation
beyond biological.
Yeah, that's a great question. And the first thing I'll say is meditation isn't always sitting down or being still. Meditation can be movement.
I like it.
Right?
Yeah,
meditation
of course.
can be movement. And so what it feels like to me is, I keep thinking this, I keep picturing this meme that I see on social media sometimes. And I think it's Lisa Simpson. I don't know if you've seen this one, but there's two like side-by-side pictures of Lisa Simpson laying in a bed. And one side shows her, like completely passed out in her bed, just like a hot mess. And then the other side is like her in this beautiful lotus position with a beautiful aura. And the line says something like, what I think I look like over here in this blissful state, what I think I look like and what I feel like in meditation, but what my physical body looks like is this hot mess over here. So I think that's a really good visual of what it feels like to meditate. It's like at least I experience this on the deeper, when I drop into a deep meditation is I become light. I become energy. I become this force that has no physical presence, if that makes sense, or no physical, I become, he's raising his hand.
Yes.
That is the first time. That's the first time anyone's ever actually told us what meditation feels like.
Oh.
Yes. Thank you. It's always like it's always a roundabout answer that doesn't answer the question. So appreciate it. Yeah.
I think that the dissolving of the physicality of the body is where meditation really begins. And I think that there's a really big difference between, so I will say this. I don't think meditation can happen in movement. I think that is being meditative. And I think being in meditation and being meditative are different things. And I have maybe an hour and a half long podcast going into those things. So no need to go into that because everybody's heard it. But I do think that there is a lack of awareness around the importance of dissolving of the physicality of the body. And to get it back into the physical world, right? If you're in pain, if you have lumbar dysfunction, and every time you sit down, you are feeling a pain that is riding up the left side of the spinal column, you're not going to be able to dissolve the physical sensation of your body, right? So we do need the physicality of life, or the extra physicality of movement, to heal our body enough so that we can sit comfortably again. as amazing as that is.
Yeah. Well, the other thing too is we have tools that we can use to make meditation, the physical aspect of meditation, comfortable too. Like we can sit, we can sit on cushions, we can raise ourselves up off the floor. Sure. So there's a lot of different ways we can prop ourselves up, and everyone's going to be a little bit different, but finding that position where you can relax and let go of the physical body makes the whole process a lot easier.
You're exactly right. I took a class in restorative yoga at Spirit of Yoga, and that's where. So I don't have lumbar dysfunction, but I played golf in college. I played a scooch professionally, and I have a little bit of.
About to tell us about his lumbar dysfunction, by the way.
I thought I said it didn't have any, but anyways,
yeah,
no, I do have some, I guess, clearly. So with the lumbar dysfunction, we were set up we were set up in a space that I was basically laying on my back, right? And I was propped up as if I were pregnant. So that's what we were kind of tailoring this piece of the practice to a woman who was pregnant. And then we went through a meditation after that. And that was the first time that my physical body dissolved, and I was just pure light, pure energy, just like you were just describing. And so now I set myself up when I drop into these meditations, I set myself up in a way that, just like you were mentioning, that supports myself. So there is no pain, there is no discomfort there, and I'm not easily, but in a much more functional way, able to drop into those grander sort of experiences.
Mm-hmm. Yeah, for sure. I had a teacher once talk about like finding a comfortable spot, even like getting a patient comfortable laying on the table. A great way to get somebody tuned in is to get them to tune into other parts of their body, like, for example, your nose. Right? So if you just, without touching your nose, can you feel your nose just sitting here? Probably not, right? Can you feel your face? Can you feel your forehead as you're just sitting here comfortably? Probably not, right? You have to actually touch it or become aware of it, like hyper aware of it in order to feel it. And that's how we want your body to feel, the whole body. We want your whole body to feel like your face when you're laying down in a comfortable position or getting seated into a meditation. If you can find, some bolsters, some pillows, some blankets, something to prop you up, to support your whole body in a way to the point where your whole body feels like your face, where you don't feel it. That's kind of the name of the game right there. That's the goal. And sometimes it can be challenging, but when you find the right spot, you know.
Exactly right.
Yeah. So, okay, I want to talk about since we're talking about a stacked spinal column in the moment, and we're talking about how much pain that the general populace is really existing within. Yeah. I have, over the last month or so, started to come around to an idea that the concept of humans shrinking as we age is actually just a byproduct of having a disengaged torso, posterior and anterior chain, and the weight of our musculature just hanging on our bone structure. Because I see humans, we just tend to just deactivate everything and just hang, and we get this spinal flexion, and we get this like hunching, and we get this anterior shoulder forward collapsing. And I've realized, based on Tadasana or mountain pose or standing in the line at the grocery store, right? It's the exact same shape. I can go through a 15-minute sequence in a yoga class and you can see people like add a half inch of height to their body, and then walk out of class and it's like right back down. Do you think it's possible that if we maintain like active trunk awareness, so like 10 to 15% active engagement around the trunk 24 hours a day, or at least through consciousness, that we could fight off, or maybe not even experience, human shrinkage as we age?
Absolutely. Yeah.
Done.
I think as part of that, though, we need to sit less throughout the day, right? Because when we sit down, we have gravity kind of pulling us down onto the chair. So we do have a little bit of compression, right, in that seated position. But from a nervous system standpoint, if we sit in a chair for the large majority of the day, if we take what we know about the nervous system, in that it's going to adapt to things that are in its environment, it's going to try to conserve as much energy as possible, right, for survival. It's going to unplug, right, or detach structures that it doesn't need to be working in that moment. So if you're sitting in a chair for the large majority of the day, and that chair is providing you with stability and safety, right, it's preventing you from falling over and hitting the floor, then your brain, your nervous system kind of becomes dependent on that chair. And here's an opportunity to conserve some energy. So what a lot of times will happen, that I see in my clinic, is the brain will detach from that intrinsic core. All those small muscles that go right along the spine that keep you upright, they get all unplugged, right? If you're spending hours and hours and hours sitting in a chair, and that chair is providing you with your basic survival needs, then there's no need for your internal stabilizers to do the job. So to conserve energy, boom, they get unplugged. But when we stand up and we go to yoga, we go to the gym, we move, we go from here to there, we need our stabilizers to work. We need them plugged in. But because we spend so much time sitting down, and that becomes our new normal, so to speak, right? Our brain adapts to that lack of movement. What happens is those muscles don't activate when we need them to, as we need them to in that moment. So what ends up happening then is some other structure somewhere else in the body picks up the slack, and that's how we get compensation patterns. So if we want to maintain our posture, right, throughout our lives, yes, I think it's possible. But number two, like, I think it's a big component of that is not sitting down, standing up, supporting your own body weight, and keeping your brain connected to those intrinsic core muscles.
That's a good answer. Yeah, 100%. So I just transitioned from Optimize into to my new role as the global sales manager for this company called Sacred Plant Company. It's just a little company called Sacred Plant Company. I'm laughing because Patrick owns the company and I work for him. So, but yeah, so I've transitioned from moving around at Optimize, right, for 8 hours a day and never sitting down, to having an opportunity to set up my desk in a way that supports the standing up theory, right, that you're explaining. And I've noticed a huge difference in my ability to become aware of the areas that are not activated when I'm standing in mountain pose or Tadasana or at the grocery line, however you want to describe it, right? So, and with some of those activation things that you were just like describing, the activation of the core, the activation of even like the legs and the quads, working your way up from the floor, it has profoundly changed how my lower back feels. So it's and even then providing myself with so when you stand up, if you want to get yourself a standing up desk, that's great. But then also think about what surface your feet are on, because I started off with just carpet, and then my lower back was hurting like crazy because it was that instability, like you were saying in the yoga mat, right? There was like this instability is a good way to say it. So I've now recently placed like this plastic piece of material on the ground, and it's changed the way I feel. So I don't know, having like a stable surface also seems to make a profound difference for me. Is that something you would agree upon? Like really thinking about what you're standing on? Yeah.
Yeah, I think it kind of depends on are you wearing shoes, socks, or are you barefoot?
Barefoot. Yeah.
Okay, you're barefoot. Okay, cool. So I'm a big advocate for being barefoot as often as possible, as I mentioned at the beginning. So whatever it is you're feeling, right, between your foot and the ground is going to be sending your brain information, right? There's a lot of nerve endings in your feet, just like there are in your hands. And this is how we communicate with our environment. If you're someone that, spends all day wearing shoes, and you go outside barefoot and, maybe you walk across some rocks, your feet are going to be hypersensitive. It's going to be really, really hard to do, right? Because, all that, the nerve endings, the nerves on the bottoms of your feet are not used to transmitting that type of energy, right? They're not used to touching that type of surface. So I think it's a great thing that you can get your bare feet on a lot of different types of surfaces as often as possible. And the only thing, the reason I say that is because it's only going to keep sending information to your spinal cord and to your brain. When you feel different types of textures and different types of terrain with your bare feet, it's going to just keep sending information to your brain and sending information to your brain over and over and over again. And that's what we want. We want as much information going to our brain as possible, so that our brain then knows how to react, and it knows what structures to fire, what we need to do. Do I need to fire up my proprioceptors? Do I need to react a little quicker to catch my balance if I'm going to fall over, right? If it's a rough terrain, right? So barefoot, yes. I think the type of surface you stand on, again, it's just going to keep sending different types of information to your brain. So I would actually encourage you to keep changing the type of surface you're standing on.
Interesting.
Just to keep your brain connected and activated.
I didn't think of it as the connecting to the brain piece. That's it makes total sense. I just skipped that part. It's more of like it's a feeling for me, but the feeling can also be described as that connection of the signal you're receiving from your brain, which starts from the feet.
Well, absolutely. And the nerve endings in your feet, they come out of the spine. The part of the spine they come out of is the lower part of the spine, right? The lumbar and the sacrum. So if you have lumbar pain, one of the best things you can do is get barefoot and go walk on some different types of surfaces.
So I tried to play. My dog is barking, so if you hear that, that's Scooby. But it was. I tried to play golf. I played golf in spikes my entire life, and I swear by having that really solid connection. It helps me turn and pivot and create power. So I tried to play barefoot. And I played terrible. It was like this. It was like as if a light switch went off, and I lost the motor mechanics, the muscle memory I created of years of playing, and I went back to like 12, 13 when I was like really working on the foundation, the mechanics of the golf swing. And it was interesting what habits came back that I remembered from that time of my life. It was very, very strange how just the simple fact of like changing the interaction with the earth or the ground, the surface you're on, how much that can change the physical expression that you're trying to create.
Totally.
It was wild. Yeah.
Yeah, that's beautiful.
So back to cleats for me.
Yeah. Well, I think there's a few companies out there, some barefoot shoe companies that are now starting to make athletic shoes and spikes for golfing. So
heck yeah.
Yeah. So they have the wide toe box and all of that. So
yeah. Thank you.
Yeah.
Okay, I want to highlight something that you said, and Sara, I want to highlight something that you said, plus use kind of an example that a lot of people are familiar with, right? Because pretty often someone will go to see a doctor. They'll say, hey, I'm having some lumbar pain. They'll get sent to some type of specialist who will charge them $200 to $600 for some shoe inserts, right? And in a temporary way, that can alleviate the symptom of pain, right? But what it doesn't do, and what I think you called out, is it doesn't strengthen the foot, doesn't strengthen the musculature needed to actually to remove the pain sensation. It does make you very dependent on always having an insert around.
Right.
And I love the fact that you talked about like, hey, if you have lumbar pain, go like challenge that musculature and develop the strength and like do the work. Essentially, it's do the work. The reality is it's do the work.
Exactly.
That's what it comes down to, right?
Yeah.
We all have work.
Yes.
Yes.
But as we were talking about sitting, we're talking about sitting, and we're talking about feet, and we're talking about arches. I just like, I want to use this analogy, and I want to see if you agree with it. And I can't imagine you won't, but maybe you won't. But putting an arch support in your shoe is the equivalent of thinking you're going to build foot strength by sitting on the couch all day. Is the exact same thing, right? It's like turn the musculature off and just let it do its thing. That'll fix it.
Yeah. Right. It's kind of like a Band-Aid.
For sure, a Band-Aid. Yeah.
Yeah.
It doesn't fix the dysfunction. Again, like you said, it gives you the perception of improved pain.
Yeah.
But it doesn't necessarily fix the combination of dysfunctions that's causing the dysfunction in the foot, right?
I would argue it makes it worse.
Yeah, you become dependent on it, and you can't go without it eventually, right? If you wear them for so long, and if you're wearing a shoe insert, that means you're wearing shoes for the majority of the day, which is going to restrict how your toes are functioning and how your forefoot's functioning. You're in shoes all day long. It's like wearing gloves all day.
Hoofs. It's like wearing hoofs.
Yeah, exactly. So yeah, I think, and again, there's a population of people that I think shoe inserts are beneficial for, right? I think an older population, a population who maybe for whatever reason, they can't get active, they can't be more active for whatever reason. I think an older population sometimes, just to help mitigate their pain, the shoe insert will be, life-changing, honestly. Because there's likely with that population, they'll have a lot of other health issues that are higher priority. So in that sense, yes, shoe inserts are great, but for, general population, active adults, adult athletes, do the work, get with a specialist and do the work to fix dysfunctions.
You didn't hear it from us. You hear it from Sara, not
That's
Brian or
right.
Patrick.
Sarah said it. Actually, that's a really well-placed call out there. I really like that there is a reality that there is a time and place for symptom reduction, right? Symptom reduction can be very important. I just think it's remarkably important to understand that symptom reduction is not the same as problem solving.
Yes. I agree 100%. You're right.
Okay. So back to we're circling a long ways back, but we're at the feet. So I think this is an appropriate time for this question. You mentioned you actually thought about saying upstream and downstream, but you changed it to like from the floor up. And I think that's a really interesting and appropriate way. And I love this question, especially in the world of movement, of like, which direction is the stream operating from, right? So is the stream operating from the top of the cervical spine down, or is the stream operating from the bottom of the feet up? And I want to hear your answer before I extrapolate.
It depends. What's the fulcrum? What's the movement?
So yeah. No, I think it is constantly both ways, actually. I actually don't even think it's dependent upon the movement. I think that if you have cervical spine dysfunction, you're going to end up with distal tibial and fibular dysfunction, right? It's like you're going to change your gait if the upstream or downstream, depending on how you're looking at the body, has dysfunction. It's going to change the way that you move, and by changing the way you move, like if you change your step, you're going to end up with either a shift in your distal head or your proximal head of the tibia and fibula, right? If the gait changes, you end up with bone shifts. So I actually think it's constantly both ways, no matter what. But it's a fascinating thought exercise. I love thinking about where movement dysfunction is truly coming from and where it is landing.
Sure. Yeah, that's a great point. And I would agree with that. I think you're right. If you look at it from like a trunk rotation standpoint, if the first thing that moves, if you keep your spine upright from, C1 all the way down to your sacrum, right? And you rotate on like a spigot, right? You can only rotate so far. But if you turn your head and you look at what you're rotating towards, right? You get your eyes involved on it, right? You look and then you rotate, you might see that you can rotate a little bit further simply by turning your eyes.
For sure.
Right.
And
looking at whatever it is you're trying to move towards. It's
for sure.
Yeah. So in that sense, yeah, you're right. Like if I just try to, turn on a spigot, I can only go so far. But if I get my eyes in on it, I can cover a lot more range. So it can go both ways, definitely.
That's interesting. That's going to leave me thinking about that all night long, dude.
Yeah.
Appreciate that. Yeah. I've never really thought of it that way, but the eyes are like a huge piece to the whole mechanics of functional movement, right?
Absolutely.
I mean, it's our, 100%.
Eyes are the window to the soul, right? Yeah,
like
kind of they tie everything together. Yeah. And the muscles, the musculature, the nerves of the eye impact what happens in the back of the skull too, in the suboccipitals. So, extension, rotation, and any combination of all these degrees of freedom in the spine, a lot of it has to do with how your eyes are involved.
If the eyes are the window to the soul, and I like to think of the breath as the language of the spirit or soul, what's the
hearing?
That's fair too. No, but my question really was about like, so like how does then the breath speak to you? Like because you mentioned breath work is a practice of yours, right? And it's a passion of mine as well. How does that impact how you interact with your clients?
How does my breath
impact? Or how does breath work in general? In general, how does that relate to or tie into the things that you teach or work with your clients?
Well, I use breath in a lot of ways in my practice. Just for me personally, when I'm with a patient, breathing for me keeps me in my body, and it helps me keep my energetic guard up so that I don't absorb whatever my patient is bringing in. So staying centered and being connected to my breath helps me do that. That's one way. It also helps me tune into, my touch too. So when I'm taking a pulse or when I'm palpating my patient's body, right, feeling for adhesions or feeling for any, just assessing them, my breath helps me stay connected and it enhances my sense of touch. So I can really get a better feel for what's happening in their body, and not even just their physical body too. Like staying centered and using breath, I can feel their energy. I don't even have to touch them. So breath work for me as a practitioner is huge. It's huge for a lot of reasons. Breath for my patient can be both treatment and it can be diagnostic. So if I'm watching my patient breathe and I'm just seeing the rise and the fall of their shoulders and maybe a little expansion of their chest, of their ribs, it tells me that they're stuck up in their neck and their shoulders, right? They could be very much stuck, and likely they're stuck in a sympathetic response in that fight or flight part of the nervous system, in a way that they're not getting grounded. Their breath isn't getting grounded into their diaphragm, into their lower abdomen, which is a much more parasympathetic, a rest and digest type of breath, like a recovery breath. So, that's one way. From a patient standpoint, it can be treatment, it can be diagnostic. There's a few exercises that I'll do too, where I use the breath as a release technique, right? Where I might just very lightly, with maybe 1 or 2 pounds of pressure, touch a muscle or a joint or something that's dysfunctional, right? Something that just feels stuck, just so that they have a little bit of awareness of whatever it is I'm touching, right? And then I'll have them direct their breath to that area that I'm touching. And from the inside out, we get mobility. We get a joint mob, so to speak, right? Whereas I wouldn't have to go in and manually do the therapy. I can just give them a little cue and have their breath do the work. And that's treatment.
That's treatment.
So,
That's right.
you know, there's a lot of ways. Oh, another way that I'll use breath too is it helps me understand how much control they have over their movement, right? If they're trying to perform a movement that they don't own, right? And by ownership, I mean a movement that they can just relax into and perform start to finish without losing their balance or without straining too much, right? If you have to force your way into a movement to complete a rep, then you don't own it. There's something there that needs to be corrected, whether it's stability, whether it's mobility, whatever it is, a strength issue, anything. So if they're holding their breath and they're wincing like this as they're moving, they've gone too far. They're working at a capacity that's beyond what they can, you know, perform safely.
I see a lot of that on the yoga mat too, as well. People going past their edge and the breath suspended while they're past their edge or moving towards that edge. Yeah.
And they say, oh, you know, look what I can do. I can muscle this. That, okay, cool. But like, it looks like it's painful.
Sure. It probably is.
If someone that has the strength, the stability, the mobility, they have all the access, they own that movement, they should be able to complete it start to finish and never lose their breath.
Never.
So breath is huge for a lot of reasons.
Did you, when you were playing, so Patrick played college baseball, I played college golf, you played college softball, correct?
Yes, I did.
Yeah. So I did my research.
Yeah, I know. Yeah.
Were you aware of the breath during your competitive days?
No.
Yeah.
Oh, and I
Me
wish
neither.
it was.
Me too.
If only, you know, I knew then what I know now. You know?
I've right 100%. And one of the things they talk about a lot on the PGA Tour, I'm going to nerd out on some golf for a second, but what they talk about a lot on the PGA Tour is breath control, right? And particularly in between your moment of execution or the moment of performance, right? So as if you can use any analogy you want to, or any sport really. So in between plays in football, like while you're in the batter's box in baseball, before you swing, before a ground ball comes to you, before you hit the golf ball, before you swing, before you get ready to field a ground ball in softball, whatever it may be. Like, so that, and so I used to be a super golf nerd, then follow around Tiger Woods, like really specifically go to golf courses or tournaments and follow him around. And one thing that I noticed, but I never understood until we're having this conversation right now, is the amount of effort and energy he put into simply modulating his breath. It was never through the mouth. It was always through the nose. His mouth was never open. It was always this, he walked with such a rhythm that you could tell his gait, right, was a function of the breath. It was as if the breath was moving him.
Yes.
And it was, God, it's giving me the goosebumps thinking about it, like just how in tune he was with that. But now they're just starting to like roll out into like this broad spectrum on the tour and other sports as well, of how important it is to connect the breath to whatever you're doing, whether or not you're standing up making sales calls, or whether or not you're planting seeds in the earth, or whether or not you're packing herbs, or whether or not you're with a client in your clinic, right? So the breath is such a tool to modulate your human existence. I would invite anybody into just exploring their breath a little bit deeper.
Yeah, I love that. You're so right. I think breath is underrated, and it's probably the most readily available self-care tool that we all have, regardless of, you know, wherever we are, whatever we're doing, we're breathing.
Beautifully put.
And if we take just maybe one or two of those breaths that we're going to be taking anyway all day, and we put some attention behind it and intention behind it, it can change your day, right? It's incredibly beneficial. So, you know, if we just take one of those breaths or two of those breaths or just a couple minutes and put some intent behind it, it's incredible what it can do.
Incredible.
Yeah. Yeah, you're right. Thank you for that.
Of course.
Yeah.
Thank you for this conversation. I'm enjoying the heck out of it.
Yeah, me too.
Yeah.
Me too.
These are like the ones we love so much. They're super organic and just we're flowing out. It's beautiful.
Yeah, it's just fun.
If you could, let's give you Sarah, if you were able to craft a program for young athletes, right? Because I think, it's so easy, right? You look back, and you're like, well, I didn't really understand the mechanisms of movement, right? And at the same time, like you guys are talking about, somebody's in a yoga class and they're overextending. A lot of times they don't even understand the responsibility of the shape, right? So one of the things that I think is really important from a teaching perspective is like, hey, if we're talking about triangle, the responsibility of the shape in triangle is both a safety of the knee mechanism, safety of the hamstring mechanism, but also length of the spine, which is a portion that is just generally thought through. It's just, how can I contort my body so that my hand gets as close as possible to the floor? But if you start talking about, hey, your responsibility is length of the spine, then there's a shift. I'm not sure. One of the challenges I have, right, is I'm not remarkably capable of communicating complex ideas. Period. How about that? I'm not remarkably capable of communicating complex ideas. Period. But translating those ideas down to 10 and 12-year-olds is remarkably difficult. I've attempted that several times, and I would say I've failed pretty much all the time. Part of it is that as we're little kids, our body does feel like our face, right? Like nothing hurts when you're a little kid. There's not a movement that you can get into that provides you negative feedback. Everything feels natural because everything is natural. It is the way you've been taught to move or the way you've observed movement around you. But if you are going to craft something for a young athlete, and I think that, if you go too young, it doesn't really matter. You could start with something. You could start with appropriate Tadasana, but I can't work with a 6-year-old brain. But if I was going to work with a 12-year-old brain or a 13-year-old brain, right? Like aspirations of college could begin at the beginning of high school, right? So if we're looking at a 12 to 13-year-old, what is something that you would do to really instill some type of a future benefit, a future program that would offer benefit for athletic performance, as well as the reality that you're probably not going to be a professional athlete, but you are going to live with all the injuries that you create for yourself over the next 8 to 10 years while you attempt that dream?
Yeah. That's a great question. Yeah. And I'm racking my brain. There's so much that would go into it, but ultimately when we're dealing with young people, and this is true for adults too. So I think I would apply what I'm about to say to a 12 or 13-year-old to adults also. Is first, keep it simple. First, keep it simple. Not giving them too many cues about movement. Just say, hey, this is the goal. This is what we're trying to accomplish. Do it in a way that feels good to you. And I think that will give them enough cue to first just be in their bodies, to try something new and different, but also maybe to try it a few different ways until they feel it click, right? When you feel like, when you get into flow state, you're in it. When you do something that is strong and powerful and explosive, you feel like it resonates through your body. To coach somebody through that, sometimes like using too many words or too many cues is not going to get it done. It's just more confusion. So just telling them, leading them, maybe demonstrating a movement and say, okay, this is what we're trying to accomplish. Do it and see how it feels. If it feels good, great. Try it in maybe another way to see if it can feel better. Right? And that, I think, will bring them into their bodies. It'll connect their mind and their body together. It'll build their body awareness. And just through that, they'll gain more proprioception. They'll gain more confidence in their movement, and hopefully that would it would inspire them to keep moving throughout their life and trying different things. But keeping it simple, and and allowing them the freedom to play and asking for that feedback. How does that feel? Does it feel good? Does it feel not good? And how can it feel better? Try it in a different way. That's what I would do.
Yeah, I like it. I like it. Can I drill into, so what position did you play in softball?
I played second base.
Second base, so overhand throws.
I was more of a sidearm. I was quick, sidearm, overhand. Yeah, mix of all.
But the shoulder mechanism is relatively similar. Do you think that do you think there's a key for preventing humeral head displacement within the overhand throwing mechanism?
Sure.
What is it?
I mean,
is it scapular retraction?
It's stability.
Scapular stability. Yeah.
It's stability.
So, fair. Okay, fair.
Yeah.
How can we get more granular around that answer? Like what? So I would say we're in a world of relative instability around humeral head placement.
Sure.
And that comes from the amount of time we spend seated at a computer or looking at a phone, right? Like
yeah.
we are just
head
in this rounded front shoulder position, way too much time to expect normal humeral head function. I think it's just very, very tough. But in sports that have an awful lot of overhand throwing mechanism, the torque that is put on the end of that movement is really, it's pulling against the stability, right? So I would say this, even if you had normal stabilizing musculature around the shoulder, you have the capacity as a human to overextend the structure of the humerus with a throwing mechanism. So even with normal stabilization, I think you can lengthen that musculature just from the pure torque at the end range of the motion, where you have permanent dysfunction in that stability musculature. So I'm looking at how you create a mechanism of movement that provides both the performance of the overhand throw, something that's pretty integral to human evolution, right? Like we've been throwing things overhand for a pretty darn long time, 200,000 plus years easy.
Yeah.
But we still don't seem to be remarkably well adapted to that specific mechanism, at least with like a stone-shaped object, like a spherical object. Like
it's a different thing.
It's very different.
Yeah, sure. I mean, no matter what you're doing, a throwing motion involves a lot more than just the shoulder. You know that, right? You were a baseball player, right? So that's something to consider too. It's like, we're not just talking about the shoulder complex itself. We're looking at the whole fascial sling. We're looking at, you're stepping with your opposite foot. You're pushing off with your back foot, right? So we're looking at that, hip extension and the follow through and so it's a whole dynamic movement of the body as a whole, not just the shoulder. So, to nail it down, to kind of pinpoint one or two things with this motion, I think that's really hard to do because it's such a dynamic full body movement that involves so much more than just the shoulder. So I kind of threw out, stability. Yeah, that's true, but there's so much more to it beyond that. Does that make sense?
Yeah, it definitely does. It's a pretty interesting. There's there's a lateral edge. There's a left. So if you're right-handed, there's a very interesting lateral edge of your left hip component.
Yep.
Which is so I guess what's fascinating about this, right, is I've never really heard anybody talk about there's a lot of really expensive shoulder surgeries specifically designed to repair the problems that happen from that movement. But I haven't ever actually heard anyone really think through the mechanisms of creating stability through a 90-mile-an-hour release of the shoulder.
Yeah, that's, I mean, yeah.
I think there's actually something there though. I think that extending the scope actually may be really valuable. And again, I don't think I've ever heard anybody talk about it, but someone should.
Yeah. I mean, when you get up to the higher levels, you know, a lot of my colleagues that work in professional sports, and in particular, you know, I do work with a lot of baseball players here. This time of year in spring training, we get a lot of baseball players in town. You know, throwing isn't just about the arm and the shoulder. And every movement, just like we talked about earlier, every movement starts either from the top or the bottom, right? From the ground up, right? So we have to look at, you know, that push off of the back foot, right? That generating that power, generating a force between your foot and the ground, like a pitcher, for example. If you're a pitcher, you're generating a force between your foot and the pitcher's mound. And that force comes up through your body and is released through the shoulder. So to reach that 90-mile-an-hour plus fastball, it's not just your arm, it's your entire body and the force that you're generating from the ground that's coming up through your entire body. So there's that power aspect coming off of that same side, that backside foot and leg. And then there's that stability part that's coming from the front side that you have to rotate up and over and follow through over, right? And you have the deceleration aspect too, right? That follow through. After you release the ball, the movement doesn't stop there. The movement keeps going long after you let go of the ball, right? So there's a lot of components that are involved in that throwing motion, in any motion, to be frank. So if there is ever a problem here, right? If there's pain here, it doesn't necessarily mean that's where the problem is. Now, they'll, like you mentioned, you know, there's rotator cuff damage, there's labral tears, there's ligament issues sometimes, right? There's tendonitis, and that's obviously local pain. But the dysfunction isn't always rooted in the shoulder. It can be rooted anywhere else in the body. And that's where assessments like an SFMA, a selective functional movement screen, or the NKT, a neurokinetic therapy assessment that I talked about earlier, that's where all that can come in handy. Because the place that hurts on your body is not always the root cause of the pain. That dysfunction can be somewhere else. Does that make sense?
Yeah, it does.
Yeah.
They have those floor plates now that can measure the force, the amount of energy that you're generating. They have like a dual one for a golf swing, and then I know they have one for a pitcher's mound as well that measures how much force you're generating from the earth through the throw or through the golf swing. Yeah,
that's technology is so
cool.
Another
so
company
cool.
that has these little computer chips that they'll put in their the shoe inserts that measure you know, power and explosiveness and all of that, so that when it shoots data back to the coaches, they can identify, you know, how strong how strong their performance is, and basically like when to program in recovery, and when they can like maybe amp up their volume, their training volume too. So it's really, really fascinating. That kind of technology it's new and up and coming, and exciting. Yeah,
that's cool.
Yeah.
I'm looking forward to, on a personal note, I'm looking forward to the opportunity of working with you. I know that we've communicated back and forth several times, so
we'll have to happen soon.
Yeah, we will for sure. I'm super grateful for you in this moment. Yeah,
well,
thank you.
Yeah, thanks for having me.
Yeah, Sarah, thanks for coming on. This was a fun dive into movement. This was a good time.
Great, yeah. Having a great time.
Brian, anything to wrap us up?
Yeah, I got one question for you. I got this question I like to ask a lot of our guests. So thanks for the segue, Patrick. So throughout your life, right, you've said yes to things, you said no's, you said a lot of no's to things. So what has been more impactful? The things you've said yes to, or the things you've said no to?
Wow. That's a great question. What's been most impactful for me? Things that I've said yes to, things that I've said no to. Oh gosh. I think that every time I've said yes to doing something that scares the shit out of me, it always works out.
That's the first time you swear the whole time.
Thank you. I knew I wouldn't make it the whole time. I did pretty good though, right?
You did. Heck yes.
Yeah,
Heck yes. So the things you said yes to, yeah.
Yeah, I think saying yes to things that scare me. Those are the things that work out the best. They always turn out, they always elevate me on some level. So saying yes to that shit that scares you.
Yes. It's been one of the most impactful things in my life too, is saying yes to the things that scare the shit out of me.
Yeah. You end up with a lot of great stories too.
You do. You do.
I continue to accumulate those things. So it's a challenge. It's not easy to do, to face those fears and to do the hard thing. But man, I have journals full of stories and things that I can look back to, years from now and say, I was a badass. I did some shit in my life.
That's it.
Yeah. So that was a good question.
We'll look for that book release then on your journaling of all the stories.
Yeah, well, hey, I do have a book coming out. I am working on a book actually.
Cool.
TBD sometime towards the end of this year, but it is coming. So thank you for that.
And I think you have a special treat for our listeners too, which we'll put in the show notes. Correct?
I do. Yeah.
Yeah.
Something that I work on with my patients a lot. Something that's been beneficial for me, and I'm sure you guys practice this too, is a morning routine, right? Setting up your day in a way that's connected to all three of those parts of your body that we mentioned at the beginning, right? Getting your physical body set up, getting your emotional body set up, and your spiritual body set up first thing in the morning is probably the best way to set yourself up for a high performance day, right? To get everything dialed in and working synergistically, all three of those bodies, what you do and how you do it and the decisions you make will be 10 times. Well, don't quote me on the 10 times, but it'll be a lot
11
better.
times.
11 times, 12 times. It'll be a lot. Your decisions will be clearer. Your actions will be more confident when you're dialed in first thing in the morning, rather than getting up and starting your day in chaos. Start your day with some focus and attend to all three of your bodies. And so I put together a checklist that I share with my patients just to help them develop that morning routine. And so I wanted to give that to your listeners.
That's amazing. Yeah, thank you.
We will have a link to that in the show notes for this episode.
Wonderful.
Sara, thank you so much for your time on Becoming Legendary. Thanks for being rad. Keep doing rad things.
Thanks, guys. This was a lot of fun.
Yeah. Thank you, Sara. Appreciate you so much.
All right. You too. Thanks, guys.